June 19, 1865. Federal troops under General Gordon Granger reach Galveston, Texas, and read General Order Number 3 aloud. The enslaved are free. But they have been free, on paper, for 2.5 years. They simply were never told. This map shows the physical reality of that delay. A freedom can be declared in Washington, D.C., but it only arrives in Texas when someone carries it, by hand, the last mile. That gap is a deliberate mechanism. Justice is not handed down from above. It has to be built and transported over physical ground. Fast forward a century and move the map west to Los Angeles. In the 1980s, Karen Bass works in the emergency room at LAC plus USC Medical Center, one of the busiest trauma centers in the country. Night after night, she sutures the physical casualties of a failing city. Crack cases flood the doors, followed immediately by gunshot wounds from territorial wars over the drug trade. At the time, the political consensus treats this strictly as a criminal failing. Politicians on the left and right agree the answer is the war on drugs. More police, mandatory minimums, and rolling battering rams through South Central. But Bass watches the social order fail right at the bedside. She realizes that patching up bullet wounds is a hollow exercise if the hospital operates blind to where the violence originates. The emergency room treats the symptom. To stop the bleeding, she has to leave the clinic and hunt down the cause upstream. Bass leaves medicine and founds the Community Coalition. Instead of relying on top-down academic theories, she and her team go door to door, asking thousands of South Los Angeles residents a single question: what is killing your neighborhood? This visualization aggregates their answers. The data coalesces into a hyper-dense cluster of pay-by-the-hour motels and liquor stores. Residents point the finger directly at the built environment around them. Bass counts roughly 500 of these stores across South Los Angeles. Packed too thick, this vice infrastructure acts as a physical magnet, drawing in and rapidly accelerating neighborhood instability. You cannot heal a population without redesigning the geography of their block. The true battlefield for public health is spatial. In April 1992, the 4 police officers who beat Rodney King walk free, and the city splits open. Los Angeles burns for days. When the smoke clears, roughly 200 liquor stores, many of the exact ones the coalition had surveyed, are gutted. Bass tells the New York Times it is a miracle that these hazard sites are suddenly gone. Her words land as a heavy wound. That destruction devastates the Korean American community, who had pooled their resources to buy those stores and lost roughly $350 million in the fires. Facing this friction, Bass relies on her roots growing up in a diverse, working-class neighborhood. She refuses to retreat into rigid ideology, instead bringing Korean American business associations and Black and Latino organizers to the negotiating table. Through these negotiations, she secures a landmark nuisance abatement ordinance and lobbies for municipal transition money. Together, they convert dozens of burned lots into laundromats, markets, and childcare centers. Raw grievance is a starting point. Lasting spatial justice requires turning street-level protest into hard, negotiated policy. This forces us to ask a final diagnostic question. Why were 500 liquor stores allowed to saturate South Los Angeles in the first place? Look at this 1937 residential security map. It outlines the mechanism of redlining, where government appraisers drew color-coded lines to mandate segregation. These borders functioned as a funnel, legally blocking unwanted businesses from wealthy zones while forcing retail hazards directly into Black and Latino neighborhoods. At the exact same time, deindustrialization shuts down the auto plants and steel mills that had provided the community with stable union wages. The casualties Bass saw in the trauma ward in the 1980s were engineered by city planners decades earlier. The bleeding is modern, but the wound is historical. That engineered map is the Galveston Gap repeating itself. It is a promise of equal protection withheld on the ground, neighborhood by neighborhood. The delay of Juneteenth is an ongoing condition of American bureaucracy. Rights exist on paper, but capital and safety are actively routed away from the people who need them most. Recognizing this, Bass crosses from the outside to the inside. In 2004, she runs for office and is elected to the California State Assembly. Her entry into government takes 30 years of organizing and scales it up to state-level lawmaking. She tracks the pathology from the human body to the street corner and finally to the legislative floor. Inequality cannot be erased by a single decree. Justice only arrives when people commit to building the infrastructure and carrying the work, by hand, the last mile.